Today is October 1st, which means it's the start of Breast Cancer Awareness Month. And today we have to talk about this pandemic and how it's made screenings more critical now than ever. According to the CDC, we are seeing an 87% decline in breast cancer screenings. And there's a real concern now that it will result in a tidal wave of stage 3 and stage 4 breast cancer cases. I'd like to bring in its founder of the Susan G. Komen organization and co-founder of the Promise Fund, Nancy Brinker. Nancy, thanks so much for being here with us.
Thank you, Kira. It's wonderful to be here with you today, and thanks for covering this topic.
Of course, and we always do. It's important to us, and obviously we've had a lot of women impacted, even here at ABC, by breast cancer. So we love to talk about it and promote the importance of getting mammograms. And, you know, we've talked about these cancer cases, Nancy, and how they've gone undetected during this pandemic as people have skipped their appointments, not been able to get out of the house, and it's been making mammogram screenings, you know, even more urgent. Let's just remind folks how important these are to detect cancer and how we need to make up for the lost time.
Well, breast and cervical cancer are two, Kira, of the largest cancer killers of women. 80 to 90%. That's how far behind we are in women, the drop in women getting screenings for breast cancer last year in 2020. And I'm very afraid of the dire outcomes, and they'll come quickly because people who miss screenings and have early disease, it can easily go into very advanced disease. Particularly, we notice this in populations with disparities, which is what the Promise Fund of Florida deals with. We have 85,000 women in the center of our state in Palm Beach County who have no medical home, no insurance, no Medicaid, no way to access or afford breast cancer care. So we created a screening center, subsidized screening center. And so far we've screened, treated, navigated, and taken care of over 10,000 of them. And we have to be able to keep this up. We're very worried, though, about people not coming in for their screenings and getting taken care of.
And, you know, 2021 marks 50 years since President Nixon declared a war on cancer. I mean, I remember that phrase and that mission. Where does the U.S. stand in this so-called war now? I mean, a lot has happened with regard to therapies and treatment.
Well, you know, a tremendous amount of research has been done in this country. The organization I founded in 1981, honoring my sister, has given literally billions of dollars to research and applied care in communities. But this is where we're missing, all of us, and why we created the Promise Fund. It is the disparities patients have, and they suffer the most because they have no access to care, no affordability, and we have to build systems. And that's what we're doing in Palm Beach County, is creating systemic change in our healthcare system so we can render care to people in the earliest stages when we believe breast and cervical cancer are curable. And it's really, really important. In fact, today we've started our Pink Boots campaign, where we're asking every woman who wants to join us, the Promise Fund, to get a pair of pink rain boots, and we're wearing them all over, and we're going to wear them every day until we've made a big dent in this problem, and we're moving very quickly.
You know, just for a moment, just to personalize, we're talking about a lot of developments and stats and where we stand right now. But just for a second, Nancy, because it's been such a long time, taking it back to your sister, when you started this organization, I just think about, you know, how she's looking down on you thinking, wow, you have created an unbelievable organization, moved on to another organization. I mean, my guess is you just feel her spirit with you on a regular basis.
She was an extremely important person in my life. And when someone looks at you, who you love very much, and asks you to do the one thing, cure the disease, and the next part of it was take care of those people who are very under-resourced. Because she said, even as she was dying, and we were sitting in a cancer clinic one day, she said to me, you know, where a woman lives shouldn't matter whether she lives. And that's our mantra. And we get up every day, Karen, we put our pink boots on and we keep going. And we want to see this campaign and our style of this systemic change go to every community in America. It can be replicated at really a very low cost. It takes a lot of human will, commitment, gathering what resources are available in a community to help people be screened, navigated, treated, and hopefully overcome this disease at an early stage.
Nancy Brinker, thanks for helping save so many lives for so many decades. Appreciate you.
Thank you for having me today.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.